In Doctor on Call, we believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Doctor On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online. So the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Doctor On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy. Hello. Very good evening, ladies and gentlemen. Very nice to have every one of y'all here with us today. Welcome to 10 things we want to know about cholesterol. Are y'all excited? Guys, this is going to be a very, very interactive session. I hope you guys can interact with me at the same time. All right. So you can actually put in the chat box if you're here. all right, and say that, yes, I'm ready to start this. All right. I'm going to give a few minutes for all of y'all to get ready and settle down. If there's anyone else you'd like to invite, quickly send them the StreamYard, because today we're going to discuss a very, very important topic. All right, guys? All right, fantastic. Can I see who else is here and where are y'all from? Would y'all like to comment? You can leave a comment over here. Hello, Mr. Chuck Tang. Hello. Yes, it's a fantastic topic, Alyssa. Trust me, this is one topic where everybody would really want to know about cholesterol. Some people are thinking that cholesterol is all about, being a little bit chubby here and there, a little bit cute. But let me tell you, there is more to it. And we've got a very, very special guest here today to tell us all about it. 10 things you got to know all about cholesterol, right? I hope all of y'all are ready. I'm going to give y'all 1 minute, just 1 minute right there, to quickly send the link for this StreamYard to your family, to your friends, because let me tell you, whatever you're about to learn today is going to take you a long way. All right, guys? And it's very, very difficult to get the special guest. It was a very personal invite to actually get him here because he's so busy. Everybody around the world literally, wait for him for his treatment and all that. He is literally the specialist in fixing the broken heart, right? So quickly send this link to your friends, your family, so they too can benefit from it. And let me tell you guys, we have got a lot of surprises until the end of this session. So make sure you stay till the end, all right? Ladies and gentlemen, why don't you type into the chat box where you're from? Let me know your name and where are you from? Nur Alisa from Kuantan. Hi, Alisa. Nice knowing you. Chiak Tang. Hi. All the way from Sydney. Fabulous. We've got people from Sydney. Lukesh from Damansara. Lovey Lin from Jakarta, Indonesia. Hi, Lovey Lin. Fantastic. Sarah from Cheras. Amazing. Sabah. Oh, wow, guys. This is amazing. We've got people not just from Malaysia, from Indonesia, from Sydney, from Sabah. Fantastic. Mr. Wong from Cheras. Great. Nirmal from Penang. Wow. Looks like people are tuning in from all over the world. Everybody wants to know all about the cholesterol, right? Again, guys, if you guys want to send your link to someone, quickly take your phone, quickly send it to your loved ones, your family, your friends. Everybody has to know about this. And let me tell you, it's the best time to know right now, live and exclusive from our very special guest over here, right? I hope everybody has sent the link already. So does everybody want to know who our special guest is? So get ready to be blown away, all right? We've got a very charming young gentleman today to lay it out there for all of us. Top 10 things you got to know about cholesterol, okay? He is actually affiliated with the Department of Medicine all the way from University Putra, Malaysia. And currently, he's also the consultant cardiologist from Sunway Medical Center. Let me tell you, ladies and gentlemen, he's not an ordinary person. He has authored and co-authored various publications, and he has received so many awards for his contribution to the scientific community. He's literally got a mark for himself in the scientific community over there. All right, ladies and gentlemen, I hope you're ready to meet him. He is none other than Dr. Foo Yoke Loong. Ladies and gentlemen, can we give a very warm welcome to our special guest today, Dr. Foo Yoke Loong over here. Hello, Dr. Foo. Thank you for joining
Dr. Fatima. Thank you for the kind introduction.
Yes, ladies and gentlemen, this is our young, charming doctor over here.
Hello, everyone.
I hope you all will give focus 100% to what he's teaching and not just how he looks. Huh?
Thank you for the introduction. Yes, how's everyone? So I think it's a COVID era right now. It's very dangerous. So stay safe and stay negative, everyone. Okay, this is the only thing we ask you to stay negative. Okay, do not get COVID at this point in time. It is very dangerous. And this pandemic is not going to end anytime soon. So for those who have not been vaccinated, please go and enroll yourself in the MySejahtera app. I myself had got vaccinated. I got vaccinated in March. I was the first few batches who got vaccinated. I'm well. Okay, so don't worry. Please register and get the vaccination. This is the only way we can fight the virus.
Best advice ever. Ladies and gentlemen, just so you all know, I'm going to give you all a little bit on our surprise. Okay, so Dr. Foo over here is going to give us a whole insight on 10 things you got to know about cholesterol. But throughout the session, we will be throwing in surprise questions. All right. So there will be 3 questions throughout your session. These are our giveaways. 3 questions throughout the session. We won't tell you when exactly it's going to happen, right? You got to stay all the way till the end, and you have to answer the question. The fastest and the most accurate answer, all 3 questions, will receive a free home health screen worth RM 262 ringgit. That's right, ladies and gentlemen. I hope you all are ready to grab this home health screening. It's absolutely free, worth RM 262 ringgit. So hang on tight to the whole session. Make sure you're ready to answer the question, the fastest and the most accurate, right? Right back to you, Dr. Foo.
Okay, so I think you got the giveaway. So there will be some 3 questions during the webinar. So everyone just listen to the entire webinar, and I'm sure, I can guarantee you, it's a very simple question. It's very easy to answer, but the first 3% or 4% who quickly answer the questions will get the winner. So I think let's start with the topic. I'm sure everybody's here. So I think our topic today is 10 things you need to know about cholesterol. So all of us know that cholesterol is a very dangerous part. If you have too high cholesterol, everyone is worried about getting a heart attack and also a stroke, which they are rightfully so in thinking about that. So let's start about this first. So for me, there's a triad of disease, what I call or term them the silent killer. Okay, so first is hypertension. Second is dyslipidemia, cholesterol, which is our topic for today. And number 3 is diabetes mellitus. These 3 diseases is what I always tell my patients, the silent killer. Okay, why do I tell them silent killer? Because most of the patients who have these health diseases do not know themselves that they have this problem. They are most of them undiagnosed and undetected. For example, hypertension. I do have a patient who have blood pressure have shot up to 180, 200, and even 260 systolic blood pressure, and he's asymptomatic. Okay, so most of the people are asymptomatic until and unless they check their own blood pressure. They will never diagnose their hypertension. And for cholesterol as well. So again, if you do not seek medical attention, you do not take your blood test, you will never diagnose yourself with hypertension. Yes, you can say I have family history, I've got my parents, my brothers, my siblings who have high cholesterol, but if you do not check yourself, you will never diagnose it. Okay. And finally, diabetes mellitus. This is something everyone is afraid of. We know that all these problems have a lot of complications we can get involved. For diabetes, people can chop their leg, they can go for dialysis. So these are things we want to avoid. So for diabetes mellitus, they do have some symptoms. Okay, so for early diabetes, some patients or some people who have complaints of dysphagia, okay, are very thirsty. They always like to drink a lot of water. Okay, so they're always very thirsty. They always pass a lot of urine. Okay, so whenever at night, they say usually I go to the toilet once a night, or maybe not at all the whole night. But nowadays, I always go to the toilet 3 or 4 times per night. So this is what we call polyuria. So again, polyuria, polyphagia, and polydipsia. So you are always thirsty and you drink a lot of water. In certain cases, when your sugar is too high, you will lose weight. And when you lose weight, it is not the healthy type of lose weight. So when you say lose weight, is a good news. But again, in diabetes mellitus, patient will lose weight and they will be very unhealthy. They will get very tired, they're malaise, they have no energy to do anything. And these are unhealthy type of losing weight. So if you have any of these symptoms, go seek medical attention and check yourself faster. For hypertension, yes, some of the symptoms can be giddiness or headache. If you have on and off giddiness, on and off headache, blurring of vision occasionally, please again check your blood pressure, because you might have one of these diseases, which I term them the silent killer. So today's topic is all about cholesterol. Okay, so I'm sure all of you know what is cholesterol, but do you know everything about cholesterol? So in today's topic, I'll tell you 10 things you need to know about cholesterol in terms of what is cholesterol, how do we investigate it, what are the complications, and what can we do in future to protect ourselves. Okay, so most of my patients, or most of everyone who goes to seek medical attention, if they check their blood test, the first thing they will always ask is, what is my cholesterol level? Okay, so for cholesterol level, there is a multiple parts in the cholesterol. When you go and check your cholesterol, there is good cholesterol. We always hear about good cholesterol. We always hear about bad cholesterol. But we need to know that there are many other effects of the cholesterol as well. For example, there's other things such as triglyceride. When you see your cholesterol level, I want you to understand, do not only look at the total cholesterol. So one issue is everyone only remembers their total cholesterol. So what is total cholesterol? Total cholesterol is a combination of the good cholesterol, the bad cholesterol, and your triglyceride. It's a combination of three. So some people will have very high good cholesterol, but also very high bad cholesterol. So the total cholesterol may be super high. Some of the patients may have very high good cholesterol and very low bad cholesterol. But because of the very good cholesterol high, their total cholesterol could be high. So for me, this is something which you do not need to remember. For me, I look at the individual cholesterol levels. So you need to know what is a good cholesterol, what is a bad cholesterol, and what is the triglyceride. Always understand the numbers in this and not only remember your total cholesterol. So because in overall, cholesterol is an important part of our body, even though, as I said, if you drink water, you will still have some cholesterol. So what is good cholesterol and what is bad cholesterol? So good cholesterol is a cholesterol which can protect your heart. It can protect you from its cardio protection. It can reduce your risk of getting a stroke and also heart attack. A bad cholesterol, obviously, is a bad cholesterol. If you have high bad cholesterol, these are the indication that you have a risk of getting a heart attack and also stroke. Okay, so how do we remember what is good and what is bad? Very simple. Good cholesterol is called HDL, high density lipoprotein. And when you have a good cholesterol, we must keep the good cholesterol high. So H for high and high for good cholesterol means HDL. For bad cholesterol, it is LDL, low density lipoprotein. So we must keep the bad cholesterol low. So very simple as that. L for, we must keep it low, and that is the bad cholesterol. So this is HDL and LDL. And also there's another triglyceride, which we need to know and understand the level as well. So the fact number 2, or tip number 2, okay? Do you know that not all cholesterol is created equal? Okay, again, we have good, we have bad, and we have triglyceride. So we always keep the good cholesterol high, the bad cholesterol low. How low? Or everyone will always ask me how low. So for me, there's always a guidelines. So as a medical practitioner, I follow guidelines. So we do not just simply treat any individual. We follow the guidelines. We have the American guidelines, we have the European guidelines, and we have the Malaysian guideline as well. So every one of this has a little bit difference, but in general, for me, if the American guideline, they want to look at your cholesterol level and they want to bring it down at least 50%, and also they will give you, if they say you have high risk, they will offer you certain types of cholesterol medicine. For the European guidelines, they look at numbers. So if, for me, in basic sense, if you have a normal individual with no diabetes, hypertension, keep your LDL below 3.0. If you have diabetes or hypertension, keep your LDL below 2.6. If you have history of heart attack or stroke, you keep your LDL below 1.4 and 1.8. Sorry, and the latest guideline, if you have high risk of getting a stroke, heart attack, and also you have some kidney damage, we will keep our LDL now below 1.4. So it's getting lower and lower, yeah? So in summary, the higher your risk, the lower your cholesterol need to be. So very important about this slide is not all the cholesterol comes from diet, okay? 75% of the cholesterol in your body is made by your liver. So in certain terms, I tell my patient, even if you drink plain water, there will still be cholesterol in your body. Okay, so at least 75% is automatically produced because these are our normal body metabolism. It is necessary for our daily routine, but we must not keep it too high. So only around 25% of the cholesterol comes from our diet and our exercise. So in general, if you eat healthily, you take care of your food, you go for exercise, you can reduce by at least 10 to 20% of the cholesterol. So because a lot of patients will come in, I am thin, I'm thin, but why is my cholesterol so high? I eat healthily. I've got patients who are vegetarian. They don't eat any oily food at all, but their cholesterol is high. So because I tell them that 75% is automatically produced, and this could be due to other factors, which I will tell about later on. So, and one trivia is in Malaysia, okay, 4 in 10 of adults, or around 8 million of our population, do have high cholesterol. And what's alarming about this problem is most of these patients are actually undiagnosed and undetected. Remember my previous slides on the silent killer? Because this, if you do not check your cholesterol, you will never know your target, your level of your cholesterol. And the worrying part is most of these patients who actually know that there's high cholesterol are actually uncontrolled, meaning they could be on medication, but they did not reach the acceptable target which we want. Or they could be not on medication, or they could be just on diet control, but they do not go back to follow up. So for those individuals who thinks you have high cholesterol, please continue on some follow-up, check your cholesterol on and off so that you know your level. Do not just leave it alone and revisit it after a few years, because it might be too late. So, number 3. The tip number 3 is I would like to inform you what are the complications of high cholesterol. Okay, so obviously we know that cholesterol is managed by the liver. Okay, and if you have too high cholesterol, you can get complications such as this fatty liver. So I'm sure if you are some of these individuals who have high cholesterol, if you have seen your doctor and do your normal routine blood test, they will have said you have a risk of fatty liver. What do you mean by fatty liver? So simple as the word fatty liver. So it means there's a lot of fat wrapping around your liver. So in this situation, your levels of your liver function might be slightly deranged. So, and if you go and do an ultrasound of your liver, so the radiologist will be able to detect whether there's any fatty liver or not. So what is the treatment? Treatment is, of course, to control your cholesterol level. And what's alarming about this is if you have too high cholesterol, this is what we do not want: unhealthy visceral fat. So on your left is a image of a heart. So this heart is a healthy heart where there is no cholesterol plaque over there outside the heart. On the right side, you can see this yellowish part. These are all unhealthy visceral fat. Means if you are not taking care of yourself, you're obese, your weight is a little bit on the high side, there's a lot of visceral fat. And this is one wrapping around the heart. And in this patient, is very high risk of getting a ischemic heart disease. And this is what we term by healthy body and unhealthy body. Okay, we always look at the visceral fat. I'm sure everyone now is on YouTube, is on Facebook, you have on WhatsApp, everyone has shared a lot of videos for you where there's individuals who are big, who are a bit chubby, they go for exercise, they take care of themselves, and they become very slim and thin. So in actual fact, all of us have actually the same structure. Our structure of our bone and our organs are exactly the same. Even though you are slightly on the overweight or you're slightly underweight, your structure of your bones and the organs are the same. This fat is all being put on our skin, causing us to look a little bit overweight, obese as well. And if you're thin, you have too less of this fat. So what we want is a healthy proportion of minimal fat, which we want, but not too much. Like on your left, unhealthy body, and over on your right side is a healthy body. So everyone, please go for exercise, control your weight, and eat healthily. This is the only way we can reduce our risk of getting a high cholesterol and diabetes and hypertension. So I'm a cardiologist, okay? So I'm working in Sunway Medical Center Velocity. We are a new hospital in Klang Valley. We are in Maluri next to Sunway Velocity Shopping Complex. So interestingly is we need to know about this cardiovascular disease. Most of my patients, okay, do have very high cholesterol, okay? So of course, when you see a cardiologist, means they have some other problems and they have high cholesterol. We all know that heart disease is the world's #1 killer, okay? So the world, same thing as Malaysia as well, 1 in 3 deaths is attributed to cardiovascular disease. It could be due to a stroke, it could be due to heart attack, it could be due to heart failure as well. So this is something we need to understand ourselves. So as you can see, I think just 1 week ago, we have a national archer who have just died from ischemic heart disease. He's a very young gentleman, less than 30 years old, and he could have died from ischemic heart disease. So age is not a factor. Don't think that you are young, you're 20 over years old, you look healthy, but you may not be. So always go for a medical checkup, even though you are young, because there are multifactorials. When multi-factors which can cause heart disease. It doesn't mean you're obese, you've got hypertension, you are at risk. There are many other risk factors which can cause heart diseases. And this is something we need to check ourselves, screen ourselves early before we detect complication. So for me, cardiovascular disease is a progressive disease. Yes, I know there are young gentlemen who have suddenly just dropped dead because of heart attack. I'm sure we have seen a lot of videos circulating in WhatsApp, in our Facebook, people playing badminton, people playing futsal, football, running, jogging, and just could have just fainted there and collapsed and died. So this is something acute. But in actual fact, if we revisit the history, if we can, most of these individuals will have a little bit of symptoms before the massive attack. So what are the symptoms of heart attack? Okay, so heart attack is for me, I will always explain a typical heart attack from a textbook point of view. It will be a central chest pain. It could be in the middle of your chest, maybe a bit on the left side. The type of pain is heaviness in nature. It will be a heaviness of chest pain. The pain can radiate to the left hand. It can radiate to the back. It can radiate to the neck. So some people say heaviness, but this is not true for everyone. I've got patients who have just toothache. So I've got this patient, every time he walks, he gets a toothache. He visits his dentist, but then everything is normal. So in actual fact, he has an ischemic heart disease. I've got patients who have just had back pain. I've got just have a neck pain or neck stiffness. So these are multiple risks. So if you have any of this problem, please go seek medical attention and check yourself early on. So as I said just now, cardiovascular disease is a progressive disease. So nothing happens overnight, okay? So we know that from the left over here is atherosclerosis. Atherosclerosis meaning your blood vessel, there will be some minimal cholesterol plaque formation over there, okay? So minimal plaque, it is fine, okay? Then when you get more and more, then you will get left ventricular hypertrophy. Your heart might be a little bit dilated because of the atherosclerosis. Then you can get hypertension and diabetes. Then you can get a mild heart attack. So from mild heart attack, then you can get major heart attack. So for heart attack, I've got mild, moderate, and severe major heart attack. So this one, they can get stroke, arrhythmia, and then you can go for remodeling. And finally, if you survive all those, you can get a ventricle enlargement. Ventricle enlargement means your heart is dilated, and at the end of the day, you get a end-stage heart disease. So what is end-stage heart disease? End-stage heart disease is where your heart function is very poor. So when we say heart function, we look at ejection fraction. We do an echocardiogram. Our usual ejection fraction is anything more than 50%. If your EF is getting lower and lower due to multiple factors, you will get heart failure. And for me, heart failure is actually a more troublesome disease, a more suffering part for the patient compared to end-stage kidney failure. Why? Because when you have kidney failure, we still have dialysis. The individual can still go for dialysis, they can go for hemodialysis, peritoneal dialysis, and they can live a relatively normal lifestyle. They can still go out and walk. If you get a heart failure, you'll be very weak. You are swollen, you cannot walk. Every 2 steps, you feel breathlessness. You are most likely homebound. And in this type of patient, they have poor quality of life. So for me, I always inform my patient about these few things, about QOL, quality of life. I want to keep them healthy, I want to keep them safe, and I want to give them a good quality of life. Because age is a number. I don't want to keep you until 90 years old, but you have a poor quality of life. For me, as an individual, I want to live old and I want to have a good quality of life. Okay, you look at all our actors, Arnold Schwarzenegger. So all of they are 70 years old, they are still healthy and strong. So we can be like them as well. Okay, so this is something which we need to understand. So
excellent. Dr. Foo, sorry to interrupt you. We have quite a number of questions. You had such a good, beginning in the introduction and all that. There's so many questions. Can I
Okay.
ask you a
Sure,
few of the
sure.
questions in
Any
the audience?
question, please ask.
This is from Mr. Chia Kai Tang, all the way from Sydney.
Mhm.
My family has a history of high cholesterol, and
Mhm.
I also have quite high level of cholesterol.
Yes.
How would COVID affect such patients?
Okay, so a very interesting question in this COVID era. So when you have high cholesterol, okay, this is just the right slide for that. So let me just talk about this slide, then I'll go back on your cholesterol. So this is our blood vessel. So what I'm trying to tell you is how do we develop a heart attack? Okay, with just one picture, I can tell you how a person get a heart attack, why they get a heart attack, and what is the treatment and management of a ischemic heart disease or heart problem. So first and foremost, if you look at the picture on your left over here, so this is your blood vessel when you're born, you're normal. So as age increases, as you are being thrown with all the nice food in Malaysia, you get your roti canai, your nasi lemak, and then after you go up older, you get your McDonald's, your Burger King, your KFCs, and then you get more and more unhealthy food. There'll be more and more deposition of cholesterol plaque. This yellow thing over here is cholesterol plaque. And you can see over here inside the cholesterol plaque is a little bit vascular. There's some blood vessels over there. So how does the people get a heart attack? So as I said just now, you have seen videos of people playing football, badminton. These are all stressful episodes. And all this stress can actually stress the heart. And when they stress the heart, this cholesterol plaque can actually rupture. So in Chinese term, they say pao hui kun. In Malay, they say salo pecah. So this is what we terms by acute heart attack, because the cholesterol plaque will rupture, but it ruptures blood in your artery. So blood is flowing back in your artery, but that is fine. So why does the people can suddenly get a heart attack and die? Because it is an abnormal bleeding inside our blood vessel. So our body is programmed, if there is some abnormal bleeding, they will try to stop the bleeding. And in this case, they will form a blood clot in our blood vessel to stop the bleeding from the ruptured plaque. And because of this blood clot, it causes a occlusion in the artery within minutes, because our blood clot immediately. So this is the reason why people get a heart attack during exercises. Okay, so if you have high risk, don't over exercise yourself. I'm not saying don't exercise, but don't overdo it. Just do a basic minimum, or keep your heart rate at a certain level and don't go excessive. So with this picture alone, I can tell you what are the treatments of a heart attack. So first and foremost, we know that there's a cholesterol there. So we need to make sure cholesterol is low. Okay. And secondly, in those people who have risk of getting a heart attack, you always remember that, always understand that they are taking some blood thinners. So what is the usage of the blood thinner? So the blood thinner is actually used to prevent acute blockages or acute blood clot in your heart. So that even if a plaque rupture for you, your blood can still flow and it will not form a massive clot immediately. It will still clot, but it will be a slower clot and a smaller clot. And that is the reason why those people with heart attack, they are on a blood thinner. And finally, number 3, we need to keep this artery pressure low. So by keeping the pressure low is we give them some medication, which is hypertension medicine, to lower the pressure in the artery. So when you lower your pressure in your artery is more stable and it doesn't rupture so easily. So with just one picture, I can explain to you how we get a heart attack and also what are the choices of medicine which we are giving to our patient. So now back to our friend in Sydney over here. So yes, if you have high cholesterol, then we need to know what stage of your high cholesterol is. Whether you are in the beginning, you're in the mid, or you're at the end here where your cholesterol is very bad. So family history is one of a very, very important risk factor for a heart attack and stroke. So always check your cholesterol. If your cholesterol is high, always seek a medical attention and bring down your cholesterol to the respective target which we need, which your doctor will explain to you. So in this COVID era, high cholesterol can lead to heart attack, can lead to stroke, and this is one risk factor for individuals who gets COVID. So for me, anyone with high cholesterol, diabetes, hypertension, you are under the high risk category. So these are the individual who needs to be vaccinated to prevent themselves from getting COVID-19. Because once you get COVID-19, there are many organs damaged, and we have heard stories where patients get a heart attack, patient can get a heart failure, and we can get patients who get kidney failure as well. So in this COVID era, you are under high risk, and you need to protect yourself by bringing down your cholesterol, and also get vaccinated for the meantime to prevent all this complication. I hope that answer your question.
Thank you so much, Dr. Foo. There's another question over here. This is from Sally Ibrahim. So does cholesterol affect the heartbeat?
Okay, so cholesterol itself do not affect the heartbeat. So, but the heartbeat affects the plaque rupture. If your heart is too fast, beating too fast, the stress in the artery will be higher, and there will be higher chances of it to rupture. So in a patient with heart attack or ischemic heart disease or high risk, we will keep the heart rate on the lower end so that we don't overstress the heart.
Okay, thank you so much. One more question here. This is from Loveleen, all the way from Indonesia. Doctor, is it necessary to have heart attack medication at home handy? And in case of a sudden heart attack at home, what do we do as a family as an emergency step while waiting for the ambulance to arrive?
Okay, so first thing is call for help. That's the most important part. So if the patient has high risk, means if you know that the person is a heart attack patient, okay, if the person has a high risk of getting a heart attack and you are very sure that the symptom that the person have is actually a heart attack, then you can give them some antiplatelet blood thinners. Okay, so aspirin, if you can give them at home, you can give. If you have a GTN, now there's a spray form or a sublingual form. That one can reduce the symptom of pain. But for me, again, you need to be very sure that it's a heart attack, because chest pain in the middle can be due to many reasons. Okay, it can be due to just your skin problem, it can be due to lung problem, it can be due to the heart problem, and it can even due to a gastric problem. So if you have a gastritis, you have a gastric ulcer, you have a bleeding from the stomach, can also cause central chest pain. So if you are very sure, then you can take the aspirin. But if not, seek medical attention as soon as possible. Because if you are not a heart attack and you take the aspirin or blood thinner, it can only cause more harm. So unless you're very sure, then yes. But if not, just go to the hospital as soon as possible and let the professionals do their job.
Thank you so much, Dr. Foo. Guys, so this is question number 1 for our free giveaway health screen package over here. So which is the good cholesterol, HDL or LDL? Ladies and gentlemen, you can quickly type it in the chat box. Which is the good cholesterol, HDL or LDL? Right? So that is your question number 1 for our free giveaway health screen package worth RM 262 ringgit. All right? Back to you, Dr. Foo.
Okay, good. Thank you. So, as I said just now, this is how a person get a heart attack. So now I will show you some images of angiogram, which I've done before many years back, of a person who came for a heart attack, and we went for an immediate angiogram, and this is what we find. So this is your blood vessel. So again, for our heart, we have 3 blood vessels. We have 3 arteries in the heart. We have left, middle, and right. So in this case, this is a right coronary artery. So if you can see over here, I've got a catheter and I'm injecting some dye into the heart to see whether there's blockages or not. So in actual fact, our right coronary artery is like a C shape, a very big C shape. So in this patient, if you can see in the middle over here, the dye is not flowing anymore. In actual fact, this patient has an acute heart attack, and this is the reason why he has acute blockages. Okay, so these are all blood clot. So after angioplasty and after putting a stent in, after giving all the various medication, you can see the big C shape now. Okay, so from just now there was no flow at all. Now you have a lot of good flow throughout the entire artery, and this is how we treat acute heart attack. If you have acute heart attack, massive heart attack, always seek medical attention. We will do an angiogram for you, and then if necessary, we do an angioplasty and we will remove the clot. And when I say remove the clot, yes, I literally meaning say remove the clot. So this is the sample of the blood clot which I've sucked out from the artery. If you see that picture just now of the patient who has a heart attack, what we can do is we can go in to the blood vessel, we can suck out the blood clot which is in the artery. So this, my friends, are the blood clot. If you can see here is a thread-like, jelly-like, or should I say chin chow? I hope you can still eat chin chow after this. Chin chow-like material in your blood vessel, and this is how we sucked it out. Okay, so our blood vessel is usually around 2 to 3 mm, some even 4 mm. So, and then we can suck out this artery, we can suck out these blood clots, and then we can implant a stent in. So for me, the earlier you seek medical attention, the easier for us to treat you. The reason being is because, very simple, pathophysiology, common sense, our blood clot. If you actually cut yourself right now and you have a blood clot, so the initial moment or the first few minutes of the blood clotting is very soft, a jelly-like. You can use your finger to just rub it out or use a tissue to rub it out, and it will be removed and you will bleed again. Okay, if you keep the blood clot over there for a few longer minutes, for half an hour, then the blood clot will be more hard, and it's much more difficult for you to scrub it out. Same thing goes to our heart. The earlier you seek medical attention, the softer the clot is, the easier for us to remove all the clot. The longer you wait, the harder the clot is, and also the more damage. When I say the more damage, meaning when there is no blood flow to your artery, it means there's no oxygen. When there's no oxygen, our muscle in the heart will actually die. Yes, it will die. So the longer you wait, the more muscle can die. So when you go quickly, we can actually salvage the myocardium. And in our medical term, we always say time equals to myocardium. Myocardium is your muscle. The faster you treat, the more muscle we can save. So the longer you wait, the more muscle will be damaged, and sometimes we can't do anything. If the muscle died, that is it. You can have all the money in the world and we cannot save the heart. So if you have any problem, please seek a quick medical attention. So our tip number 5. So we need to know what are the causes of high cholesterol. So everyone wants to know. I said just now, I've got patients who are thin and yet their cholesterol level is very, very high. I've got patients who are very fat, but cholesterol level very normal. Yes, it does happen, and it will still happen. So for me, the risk factors is what I term them modifiable and non-modifiable. So we have modifiable risk factors and we have non-modifiable risk factors. What do we mean by modifiable and non-modifiable? Simply, modifiable is something you can change. Non-modifiable, you cannot change. So what are these? So non-modifiable is things you cannot change. For example, age. You can go to your Botox, your fillers, you can go to your facelift, you can go to your facial and look very, very young. But our genetic age will always increase. Our gender, whether you're male or female. If you're female, whether you're menopausal or premenopausal, the risk is different. Your ethnicity. So whether you're Asian, you're Caucasian, different risk factors as well. And the last is your family history and the genetic. Okay, so your father, your mother, the gene, your family history, the gene will always be around there. So if you have a very strong family history of heart disease, cholesterol, diabetes, hypertension, you yourself will have a high risk. So always seek early medical attention. Go for a routine health checkup yearly so that you know whether you have high cholesterol, diabetes, hypertension, and you can treat them early on. So now we go to modifiable risk factors, things you can change. Obviously, if you have a healthy lifestyle or unhealthy lifestyle, smoking, alcohol, obesity. Yes, obesity is not a disease. You can help yourself by exercise. There's a lot of ways we can reduce our weight. So if you have diabetes, hypertension, and cholesterol, these are the things we need to modify. We treat ourselves, treat the diabetes, treat the hypertension, and treat the cholesterol. And when you do all these things, you can reduce your risk factor for getting high cholesterol and also escaping heart disease and stroke at the later stage. So these are the modifiable and non-modifiable risk factors. So they always say that the eyes are the window of the soul. Okay, So over here, this is very true. Okay. So how do we know? As I said just now, from the very beginning, it is a silent killer. Okay. So how do we know that the patient has higher risk of getting high cholesterol? So in little fact, go look at your friend on your left or on your right. If you have family members, look at them now. If you have friends, you are doing all the video call in future. We have to have a good MCO. If you're seeing your friends later, once the pandemic is over, look at their eyes. Okay, if you're a guy, don't look at the girl's eyes too much. Then they will think differently. So the eyes is actually the window of the soul, and in this fact, is the eyes can see whether you have high cholesterol or not. So this is what we call bicental asthma. Look at your parents' eyes now. Look at your friends' eyes, your family's eyes. If there's any whitish material in the eyelids, can be upper eyelids, can be lower eyelids. If you have any of this whitish material or yellowish material, this could be cholesterol plaque deposition, cholesterol deposition. So those who have this one, which is very common, please check your cholesterol because you would have high risk of getting a high cholesterol. So this is the eyelid, your xanthal asthma. Next, look a bit more closely at the eye and not at the contact lens, okay? So now we have everyone with all the funny and very nice colorful contact lens. Ask them to remove it and look at the actual eye. So this is what we term by arcus sinalis. So what is arcus sinalis? If you look at the eye, this is the iris, this is the pupil, and if you look at the side over here, this whitish ring. This is not the ghost story, the ring. So this ring in the eye over here is a cholesterol deposition. So if you look at your friends and family, if there's this ring over here, if you don't know what ring, Google search Morgan Freeman, the actor. He has a very nice ring in the eye. So these are the individual who again have a very high risk of getting high cholesterol. So these are the things you can check from the eye and suggest are not confirmed whether this individual have a risk of high cholesterol or not. Okay. So again, your eyelid and your eyes. Okay.
Fantastic, Dr. Fu. I think after this, everybody is going to look deep into all their loved ones' eyes. Supposedly romantic, but
Yeah.
you know,
So
we've got a few more questions over here, Dr. Fu. Is that
sure.
okay?
Yeah, sure. No
So
problem.
this is from Aki Emran. Hi, Dr. Non-STEMI with frequent ventricular ectopic bahaya ke? ECG sinus rhythm, multiple PCV, echo is 4/20, ejection fraction is about 66%, and mildly dilated left heart chamber. Very scientific, huh?
Yeah. This patient already got a good cardiologist. Okay. Congratulations. Yeah, because your guy have done almost everything already. So again, you have non-STEMI. Just now I said we got 3 types of heart attack. You got a mild, moderate, and severe heart attack. So severe heart attack is MI, myocardial infarction, is where the blockages is acute 100%. The angiogram I showed just now is a myocardial infarction. So one below myocardial infarction is non-STEMI, which our friend here unfortunately had. So this is a moderate heart attack where there is already occlusion. So this individual who have non-STEMI, we will do an angiogram for all the non-STEMI patients because most likely there will be a very severe blockages and we need to unblock it. Okay, so which by putting a stent in. So I'm sure this individual who have done everything because I'm sure the cardiologist will offer all the treatment. And then you have PVC. PVC is different. PVC is the electrical activity of the heart. When I say the heart again, the heart is like a house. Okay, so over here is our heart, if you can see. So our heart is like a house. First is the structure. So the structure of the house is, you can see inside there's 4 valves and four chambers. So the echocardiogram can see the function of the heart, 65%. We can see the valve and we can see the muscle, whether there's any damage of the muscle. So that is a structure. So if you have a house to live comfortably, you need to have water and electricity. So water is the piping. So for cardiology, we term ourselves, we are the plumbers of the heart. So just now, as I said, if you have a blockages, we unblock it. So this is like a plumber lah. So high-end plumber a bit lah. I don't know high-end or low-end, okay? So this is a plumber. We can do the plumbing system of the heart. So next is electricity. That's why when you do go to see a doctor, they do an electrocardiogram, ECG. ECG is electrocardiogram, meaning the electrical activity of the heart. So in this individual, he has PVC, premature ventricular complex, means the heart is fluttering or beating irregularly for a split second. So for me, I will do seek medical attention, check your Holter, see the percentage of the PVC. If it's just very minimal, we can just give some medicine to reduce it. If it's a lot, then we can get the electrician. So the heart, we have a structural, we have a structural heart, we have a plumber, and we have also electrician in the heart. So if you have a lot of PVCs, then you can see the electrician of the heart, what we call the electrophysiologist, and they can manage your PVCs. Yep. Any more question?
Actually, there's one more. So this is from Noratna Mustafa. Does monitoring heart rate using fitness watch while resting and exercising help prevent heart attacks? High heart rate another indication of high cholesterol in the body? So this question is a two-parter.
High heart rate doesn't mean high cholesterol. So, and it's two different things. So again, our smartwatches is in a growing trend. So I think if you know that Apple Watch, okay, I don't sell Apple Watch. I'm not affiliated to Apple, but the new Apple Watch actually have a lot of system over there. If you read news, they have actually soon maybe they can even check your sugar as well. But right now, the Apple Watch is a very good way to check your heart rate. And actually, the new generation of Apple Watch, the Series 4 and above, okay, has ECG monitoring. So, but unfortunately, this ECG monitoring is not available in our region in Malaysia. If you are in America, you can unlock your Apple Watch to read ECG. So in actual fact, we have other things as well. Like over here, I have a device, this one called a Cardia. This is what we term a Cardia. So we can actually put 2 fingers and I can detect your ECG. Not all the ECG, but just one lead. So the Apple Watch also uses some similar technology to check the ECG. But unfortunately, in Malaysia, we do not have that system unlocked yet. So they are still applying for the KKM approval. Hopefully, in future, if you get it unlocked, you can do a basic one lead ECG if you have any arrhythmia. And all these smartwatches in future, I do have a lot of patients who actually come to the hospital because the watch tells them so. So it's all algorithm. I think the watches are most of the devices, the hardware is the same. It's more of the algorithm or the software. So the good ones, the software can detect a lot of things. They can detect irregular heart rate. They cannot see an ECG, but they can tell you whether the heart rate is too low, too fast, or irregular. So I've got patients that come and see me for too low, too fast, and too irregular, and we have detected some things after further investigation. So smartwatches is the way to go in future. I'm sure in future, in the next few years, more and more software will be incorporated and we can detect something. Again, accuracy may not be 100%, but these are things which are free. Once we bought it, it's free in our hand and we can detect extra things. So for me, the more you can check, the better it is. It may not necessarily be 100% accurate, but at least we can detect some abnormalities. So
excellent.
This is something which we will look for in future. Okay, and we have to embrace it as well.
Thank you, Dr. Foo. I think that explanation was extremely good. Anything more to detect things or prevent or early management, I think they'll be very helpful before it gets worse. One more question here from Janet Dires. What kind of food increases the cholesterol level?
Okay, simple as that. I will tell you in the next few slides, but I'll just tell now. I always tell my patients, very simple. Whatever food is nice to eat, don't eat. Because
very well said.
Nice, high in salt, high in sugar, high in fat, and high in oil. So these are things which we want to eat. Of course, healthy food are always not the best food to swallow. But I've got one patient who tell me I love to eat oats. She can eat oats a lot. For her, oat is nice to eat. So it may be different for everyone. But again, if very nice on your palate, means it's a lot of sugar, oil, and salt. So simple as that. Whatever is nice to food, try to cut down. I'm not saying to stop completely, but to cut down. Okay, bare minimum. For example, anything rice, a lot of oils, fried stuff, fast food, everything just cut down.
Thank you, Dr. Foo. That was very kind of you to answer this question. Ladies and gentlemen, here comes question number 2 for your free health screening, right? Name one risk factor that helps to increase cholesterol. One risk factor. Just now, Dr. Foo gave so many modifiable, non-modifiable. Ladies and gentlemen, name one risk factor that contributes to cholesterol. Quickly type in into your chat box. The most fastest and the accurate one. All right? Quickly type it into your chat box. One risk factor that contributes to cholesterol. There you go. Back to you, Dr. Foo.
Okay, thank you very much. So what is the goal? This is tip number 7. So what is our goal as an individual, and also what is the goal as your medical practitioner, your doctor? So first and foremost, our goal is to recognize. We need to recognize that we have this problem or not. To recognize, we need to go and check ourselves. We need to go investigate ourselves. And before we go, we need to understand that we might have this risk as well. Okay, so please go for your routine medical checkup. And these are things we can detect early. So again, early detection is the most important. And once we recognize that we have this problem, can be diabetes, hypertension, cholesterol, we need to stabilize the problem. So if your BP is high, we have to stabilize it, reduce it. Sugar is high, stabilize it and reduce it. And then next is we need to identify what is the cause or the root cause of you having the diabetes, hypertension, cholesterol. As I said just now, we have a modifiable and your non-modifiable risk factors. If you have identified the causes of the non-modifiable, then these are the things which we can work hard in reducing our non-modifiable risk factors. And then obviously, if you have high cholesterol, high sugar, high blood pressure, we need to deliver treatment. Okay, treatment can be terms of diet, exercise. Treatment can be due to monitoring. And then if at all everything fails, then we need to treat by giving some medication. So treatment doesn't mean just medicine, can be due to everything. Okay, so and finally we need to prevent. Again, prevention is the best medicine. So I do not want to see patients in the emergency department, because when you come to the emergency department means you already developed some complication, unwanted complication. I want you to come to a normal clinic setting just for a routine checkup. So because a lot of times when the patient comes to see me, I will always ask them 2 questions. If it's a new patient, so do you come and see me because you want to just check up, whether it's your routine yearly health checkup or twice a year, once every 2 years checkup, or you come to see me because you have some problem? Because 2 individuals, one is a yearly thing. They always come at a certain time to do a normal checkup, a normal basic checkup. That is number 1. Number 2, sometimes the patient only come to see us because they already developed some symptoms. So if the person said, oh, I come here because 2 days ago I got some chest pain, I got giddiness, I got headache, then these are the people we need to address even more further. So to investigate even more further and deliver more treatment, because they already developed some symptoms. Okay, so please prevent by checking, do a checkup yourself early, prevent before you get complication, because what we do not want to see is complication. So just now someone asked ways to lower cholesterol. So obviously now we know what are the risk factors. We know what are the complications of high cholesterol. Now we need to know what are the ways we can help ourselves to lower our cholesterol. So as I said just now, there are multifactorials. First and foremost, we need to change our lifestyle. Okay, eat healthily, go for your exercise, reduce your weight. All the non-modifiable risk factor we have to reduce. And then if everything fails, then medication is something which we need to give. So I'm sure everyone who goes to see a doctor, the first thing the doctor says, I think you need to be on medication. They will say, no. I think they just one off. If the BP is high, I got patient blood pressure high. No lah, my BP is high because I cannot sleep. I didn't sleep for 2 days. I've got patient sugar high. Yesterday I ate durian, so that's why my sugar is a bit high. Maybe it will be normal later on. Then I've got patient cholesterol high or no lah. I think the last 1 month I've been eating a lot of seafood, so it's high. So they always give answers, trying to prevent taking medication. So for me, if you have hypertension, you need to break it down quickly, because hypertension, if you not bring down quickly, you can get a lot of complication, can get a stroke, can get a heart attack. So for diabetes, if your sugar is very, very high, you need to bring it down faster, because a high sugar can cause a lot of complication as well. So if your cholesterol is high, very high, then obviously if your risk is high, I will ask you to take medicine. If your cholesterol is not that very high, borderline, I can always give a leeway for you to try your best to reduce it with whatever means, by exercising and diet. Because for cholesterol, it is not an overnight thing. So cholesterol, if you take a medicine now, it doesn't mean it will reduce your cholesterol immediately, and it doesn't mean it will reduce your risk of getting a heart attack immediately. It is a long-term gain. I always tell my patient, cholesterol is something long-term. It's not a short-term gain. So if you want to reduce, yes, I may give you some period of time, maybe 1 month, to exercise, and then you come back and check your cholesterol. Because if I don't give them this option, they will never come back sometimes, or they will just take 1 month of medicine and then they'll forget about it. For me, understanding is very important. I always inform all my patients, as what I inform you all now, the risks involved, how do we investigate, how do we treat, what are the long-term complications. Because I empower my patients to teach themselves, I educate them so that they understand the disease from A to Z, so that they can make a proper decision on how to help themselves. Because for me to help you, I need you to agree that you have this problem, you agree to treat, and I will offer you everything A to Z. So I always educate everyone so that everybody understand, so that they can empower themselves to reduce all the cholesterol, diabetes, hypertension, and also reduce the risk of getting complication. So first, of course, as I said just now, diet modification, healthy living. So simple as that, whatever nice to eat, don't eat. So in Malaysia terms, try to reduce your salt, try to reduce your sugar, try to reduce your oil. If you go to the mamak right now, of course now MCO cannot. So you go to mamak right now, you say, I want to say teh or ais kurang manis. So even you say kurang manis, it will be very, very sweet. Okay. So we always try to reduce our sugar as much as possible. Of course, salt is one thing we need to reduce as well. MSG, if you have seen a lot of Uncle Roger's video of our fried rice, he always add MSG. So for me, these are things which you have to cut down. Okay, your MSG have to be reduced. Again, sugar, salt, and oil. These are things which we have to reduce. Less meat and more vegetables. So again, I know it is not easy to have a good, healthy lifestyle. Especially my patients say, I'm working in adult. I always eat outside. When you eat outside, it's always very difficult to have a proper, healthy food. So try your best. Okay, I'm not saying you need to go very, very healthy, but try your very best, and then we see, because these are the things which we need to sustain. Again, when we say treatment, it is something you need to sustain. It's not a short-term gain, it's a long-term gain. No point over excessive doing something which you are unable to continue lifelong. This is one lifestyle which we need to change long-term. Okay, so try to find something which you can accept it for the long period of time, and then assess your sugar, cholesterol. If it's still uncontrollable, then we can always top up with some medication if necessary. Because again, for me, treatment for everything, diabetes, hypertension, heart attack, stroke, the medication or the diet or the exercise you do must be consistent. You must be persistent, and you must be adherent to all the modification. It might be diet, it might be exercise, it might be medication. Because I don't want you to do half-heartedly. No point. Because if you do half-heartedly, you may protect yourself for 6 months, and 6 months later on, you might forget about it. So you must have adherence, compliance, persistence, and these are the important factors on a long-term treatment. Again, long-term gain and not a short-term gain. So lifestyle again, lose weight, quit smoking, exercise. So during the next MCO, I'm not sure whether we can exercise that much or not, but try to do. There's a lot of YouTubes now. There's a lot of Facebook Live of exercising, Tabatas. You can always do that. Okay, we are in a new era now. Some era where previously we can never do this Facebook Live. Okay, now we are all doing it, so we can always change and embrace it and exercise at home. These are things which we can do. So losing weight is very important. Of course, we have besides going for medication, we can lose weight by diet, exercise. Okay, you can see your dietitian. They can teach you how to eat. We can have a lot of other programs to lose weight as well. Like our hospital, Sunway Velocity, we have some programs to lose weight. Our dietitian can give you some extra diet or what we call a meal replacement. So these are replacing your meal. So we can give you some milk powders or some medicine, not medication, a meal replacement to replace your food. So if cannot, then we got some medications, and at the end we have some surgeries as well, which we can do. So, but these are the extreme. So always try your best first, lose weight by exercising and eat healthily. Of course, smoking is very important. Don't smoke. So I've got patient, oh, I stopped smoking already, but then I vape. So for me, vaping again is also part of smoking. We have no idea what is a long-term complication of vaping, but again, in this vape liquids, there are a lot of nicotine as well. So quit smoking, quit vaping, quit the e-cigarette as well. So again, the new things are e-cigarettes. So these are things which we need to reduce ourselves. So, and finally, exercise. 10,000 steps a day minimum. If you have your smartwatch, check your heart rate. If you exercise, I will recommend you to go to your heart rate around 60 to 70% of the target heart rate. Okay, at least 30 minutes exercise or 10,000 steps per day. And finally, so after all this thing, so if you have tried your best in exercise, you have tried your best in diet control, and still your cholesterol is high. As I said from the very beginning, so 75% or nearly 80% of our cholesterol is automatically produced by our body. So whatever you do, it can only reduce maybe 10 or maximum 20%. So if you have tried your best, and if you think you cannot go more than that in the long term, then you have to seek your medical help, and we can offer you some medications. Yes, we know there's a lot of medicines available in the market. So we have your statins, your non-statin drugs. We have a lot of things which can reduce your cholesterol. So if you have high cholesterol, your high risk factors, seek medical attention. Your doctor will advise you on the cholesterol medicine. What are the usage of the medicine? What are your target level? And what are the types of cholesterol medicine, and what are the complications? Yes, when we talk about cholesterol medicine, everyone says, oh, no, I don't want to take medicine. They say medicine is lifelong. For me, your cholesterol lowering is also lifelong. We do not want to reduce your cholesterol only for that 1 month or 2 months. I want it to be a continuous and persistent reduction. So if you cannot achieve it by lifestyle, then we have to top up with some certain medication. So for me, there's a lot of medicine, and we can always give you the good medicine. Then we slowly reduce the intensity of the medication. If you're allergic to the medicine, you have some side effects, we can always switch and change. So don't worry about that. So for those who are taking cholesterol medicine, or those who thinks that they need to take cholesterol medicine, I'm sure you've heard a lot of stories about cholesterol medicine. They have this side effect, joint ache, body ache, can sleep, cannot sleep. So yes, I agree. Whatever medicine which we give do have a side effect, but these side effects are all already reported. We already know that what are the side effects, and these side effects can be prevented, and also we can do something to change or reduce your complication. So for me, actually, there's an application or a website you all can go. It's called a statin intolerant app. So it's actually made by the American Society of Cardiology. Just go Google search statin intolerant app. Okay, ACC statin intolerant app. Or you can go to your phone and you can download in your Apple store or your Android store or whatever. Can download the ACC statin intolerant app. This app actually tells you can actually click a few things, and they can tell you whether your symptoms or your side effects is due to the medication or not. And they also will tell you what are the options of changing. whether should we stop the medicine, we can reduce the dose of medicines, or we can switch to a different medication. So everyone agrees that yes, there could be some side effect, but do not worry. If you are taking this medicine, your doctors will take care of you. They will know what are the side effects, and when they assess you during the follow-up, they will be able to help you with it by reducing your complications, because these are things which we want to work long term. So, and finally, my final slides, fun for everyone. Obesity doesn't run in your family. So not everybody is fat, okay? So it's just that nobody actually runs in your family. So exercise is reduced. So for me, we need to exercise. So don't always say, yeah, my gene is fat, so I'm fat. Yes, it do play a little part of role, but again, our usual daily routine practices do change all these complications. So please exercise, live healthy, and also stay negative for COVID-19 right now.
Thank you so much, Dr. Foo. Thank you so much. I loved the last slide. Obesity doesn't run in your family. The problem is nobody runs in the family. Excellent. Yeah. I think that's the best way to put it. Dr. Foo, we've got quite a number of questions. Is it okay?
Yeah, sure.
Fabulous. So we have got Aston Clarence over here. Does abrupt weight gain due to high cholesterol only? Does abrupt weight gain due to high cholesterol only? And there's a two-parter over here. For those who have high cholesterol and high blood pressure, is COVID vaccine safe for them?
Okay, first question, cholesterol and weight. No, it's two different things. So again, you might be very obese, but your cholesterol must be normal. So it's a multifactorial. So abrupt weight gain can be due to many reasons. If it can be that your diet, or it can be due to some other medical problem. You have other medical problems like Cushing disease, where you have a lot of steroids in your body and suddenly you just blow up and go very fat or very obese. But these are things which are unhealthy. Hypothyroid can cause weight gain. So I cannot just blame on cholesterol. There can be many reasons for increased weight. You can have a heart failure, kidney failure, and suddenly your tummy is swollen up, your legs swollen up. But these are unhealthy swellings. So again, many risk factors, but it's not entirely due to cholesterol. So for the second question of your risk factors, yes, those with diabetes, hypertension, ischemic heart disease, stroke, you are the high risk category of COVID-19. If you get a COVID-19 when you have diabetes, hypertension, high cholesterol, you are high risk of dying. Okay, yes, actually dying. Our death rate now in Malaysia is getting higher and higher. And these are the individuals need to go be vaccinated. Again, I'll highlight, you need to get the vaccines so that we can reduce you getting COVID-19. And if you ever get it as well after vaccination, hopefully it can reduce the complication of it.
Thank you, Dr. Foo. Another thing regarding the previous question, Mr. Aston wants to know, is it safe for those of them with high blood pressure and cholesterol to take the vaccine?
If you're controlled, yes. If you're uncontrolled, see your doctor. Control your cholesterol, control your sugar, control your hypertension, and go for the vaccine.
Thank you so much. This is from Bruno Boone. Will keto diet or intermittent fasting help with cholesterol management?
Whatever things which can reduce your weight can reduce your cholesterol. Again, these are all diet. We know that keto diet, how do we eat like that? Again, if you can tolerate the keto diet, again, it's a lot of acid in the body because you want to create more ketone. So if you can reduce your weight, yes, it can reduce your cholesterol.
Okay. This is from Sally Ibrahim. Normally, from what age should I start checking for cholesterol? At 30s or 40s? Thank you.
Very good question. For me, again, as I said from the very beginning, the Archer died, he's less than 30 years old. So for me, if you're anything you're working adult, I would say check once. If your cholesterol, everything is normal, then you can do every 2 yearly or 2 yearly. If anything, if your cholesterol is high, you have higher risk, your family history, then every year. So if you are more than 40 years old, I would say every year for a normal routine medical checkup. But below that, once, and then you see your risk, and then you can do every 2 yearly.
Thank you, Dr. Foo.
Yeah.
Next is from Ash Murrell. I'm turning 27 this year and have been having frequent heartburns. Is that normal?
Okay, heartburn, nothing to do with cholesterol, but heartburn can be due to many reasons. Okay, so if you have heartburn, again, it could be chest pain. As I said just now, any central pain can be heartburn, can be gastric, can be due to the heart attack as well. So if you have heartburn, then it can be your diet. Eat healthily, less acidic food. Always eat at a proper timing. And if you still have very bad heartburn, go and see a gastroenterologist for a scope.
Thank you. This is from Loveline. The doctor has given my dad a cholesterol and blood thinner medication, 2-in-1. If my dad's cholesterol level have become normal, is it okay to take that 2-in-1 medication or stop it?
As I said just now from the very beginning as well, we have targets. We don't simply treat you. We have targets. The reason you're on a blood thinner and also a cholesterol is because of how the heart attack happens. So reduce your cholesterol blood and also to prevent blockages by blood clot. So if you have high cholesterol, you have high risk, sometimes I will continue the aspirin lifelong because anytime throughout the years, you can get a heart attack and stroke. And the cholesterol, I will achieve the target. If you can achieve the target, I can downgrade the medication of the dosages. So depend on your risk. I have, as I said, your 1.4, 1.8, 2.6, 3.0, your LDL level. I will achieve the LDL level, which by whatever means. If you can achieve with cholesterol medicine, cholesterol. If it's too low, I can downgrade. So as I said, we have many types of medicines which we can use.
Thank you. This is from Lukesh. Bodybuilders looking for muscle gain need fat in food, especially at a time when energy requirement is high. Eggs also contain dairy cholesterol. Does it increase blood cholesterol level? Or can they have more than 4 or 5 eggs in one go?
Definitely. So whatever food you take do have some cholesterol. But again, if you're active, you're exercising, you're burning those fats. So bodybuilders eat extra protein, okay? So that they can convert the protein into muscle. If you eat extra protein and don't convert into muscle, it will convert into fat. So if you're taking the protein, then you make sure you burn it up by exercising.
Okay. And last question by Sito Chikin. Is extensive workout will cause high chance of stroke?
Very good question. As I said just now, depend on your risk. We know there's a lot of people who work out, exercise, and die by either stroke or heart attack. So again, if you have high risk, you're a high risk individual, your cholesterol is high, your sugar, hypertension, you have risk of heart attack, do not over excessive workout. And again, all these people don't suddenly just have a massive heart attack. They would have some minimal symptoms, a little bit on and off, which they may not be aware of. So I'm not saying they didn't seek medical attention. They may not be aware of, because again, you are young, you think you are normal, unless a bit of pain here, you think should be normal. You sleep well, you didn't sleep well. After a few sleep, then you're much better. So again, don't take all these chances. Go seek medical attention early. If you have any vague symptoms which you think can be at risk, and check yourself. And those who exercise, again, don't over excessive exercise. So what we want is just a good, healthy exercise. Don't overdo things. So if you have a risk factor, don't overdo it. If you have no risk factor, yes, you can push yourself, go more and more. But then we go slowly, slow and steady.
Thank you so much, Dr. Foo. We've got so many questions. Guys, those of y'all who still want to ask more questions, you can always book an appointment with our Dr. Foo over here. All right, you can look him up on Doctor On Call, and you can actually have a session with Dr. Foo to further inquire on more things regarding this topic, right? So now, all of y'all have been shooting so many questions to our Dr. Foo over here. I've got the last question for our giveaway today, right? Are you ready, ladies and gentlemen? Mention 3 ways to lower cholesterol. Mention 3 ways of lowering cholesterol level. Dr. Foo has given so many ways just now. His last few slides, there was like so many ways of lowering cholesterol. You need to mention 3 ways of lowering cholesterol. Come on, guys. All right. The fastest and the most accurate. You will be entitled to a health screen package worth RM 262 ringgit. All right. So put it up in the chat box. 3 ways. Mention 3 ways to lowering your cholesterol level. With that being said, Thank you so much, Mr. Fu. Dr. Fu
Thank you
over
very
here.
much.
I think it was a fantastic session. I think I personally learned a lot. He was talking about 10 things to know about cholesterol. I think we definitely learned more than 10. What is cholesterol all about? He gave a whole picture of how the cholesterol develops in our blood vessel and then what happens subsequently. I love the goals, the recognition, the stabilizing, you have to stabilize the situation. First, you have to recognize what is our current situation. Some of us think that we are young, we are, it's impossible to get a lot of things, gone were the days when you're in 60s and 70s, you're getting heart attack and diabetes and all that. In today's situation, like how Dr. Fu said earlier, Malaysia, with all our food and all that, we are number one in diabetes and obesity in the whole of Southeast Asia. So, we are all very much at risk. So number one is you have to recognize, do your early, blood tests and all that. You got to recognize the current situation. You got to stabilize it. And then, of course, you have to identify what can be done. And you got to deliver the right medication or the management. And of course, last but not least, it's all about preventing. You have the disease, you want to prevent the complication that comes out of the disease for a better quality of life. I totally love the goals, And of course, he also mentioned it's not only good to know about all this, you got to be compliant to the whole situation. You got to be consistent, you got to be persistent, and you got to have some adherence to all of this. So I think I've learned so much, the risk factors and how to overcome it, how to reduce. It was absolutely mind-blowing. And I think we have been very privileged to hear from such an established consultant like yourself. So thank you very much once again, Dr. Fu. Ladies and gentlemen, please key in or convey your gratitude in the chat box for our Dr. Fu over here. Thank you so much, ladies and gentlemen, for staying till the end and participating in our free getaway. I wish you all the very best. Last but not least from me, prevention is better than cure. So make sure all of y'all, please go and get checked, okay? Do your blood tests and all that to identify the, how is your blood levels, how is your cholesterol levels, your sugar level. It is utmost important. I totally agree with Dr. Fu. Myself, personally, I've been in the emergency before this. I've been 10 years in medical practice. I've been in the emergency, and I totally agree with Dr. Fu when he tells me that by the time they come to the emergency, most of the time it's too late, and most of the time it's very critical. Why do we have to wait for that? All we have to do is just go and do a blood test and you'll already know your situation. And based on that, we can already do the early management. If you're good to go, then you don't have to worry about it. You just have to maintain it and take the necessary precautions. If at all, some of us might feel that, oh my God, what if I find out something? We have that fear. Being Malaysian, we don't do blood tests means that means we don't have the disease. That's the wrong mindset, Correct, Dr. Fu?
Correct.
Yeah, so a lot of us have that. If we don't do blood tests, that means I don't have the disease. No lah, guys, that's not true, okay? So please go and do your blood test, regardless how old you are, the best thing is to detect early and then take the necessary precautions. All right, that's all for me, ladies and gentlemen. I'm your host today, Dr. Sashini. Thank you. Have a good evening and stay safe, stay negative.
Okay, thank you, everyone. Bye-bye. See you. Have a nice day. Have a nice weekend.
Bye, guys.
Bye-bye.